So you guys are pretty much new faces for me. So I'm Kathy Stack. Right now my title is Advisor for Evidence-Based Innovation, a job I moved into and was sort of a new job at OMB last July. But before that I'd been the Deputy Associate Director for Education, Income, Maintenance, and Labor Programs at OMB. It's a budget of over $1 trillion, and I had the Lauren's portfolio at ACF, and Food Nutrition Service, Education, Labor, Social Security. So I had lots of opportunity to, as a non-researcher, realize how much policy and how much decision gets made based on gut, intuition, you know? And every new administration comes in with their ideas on this is going to work. And then a few years later, you look back and you say, oh my gosh, you know, this didn't work. And yet, and we just layer things on and on and on. So I come at this from the perspective of somebody who, when I've seen really compelling evidence, I know that I can take that to the bank. I can take it to a Republican OMB director or a Democratic OMB director. I've had a great transition going from the Bush administration into the Obama administration simply because the leadership of both was so committed to using evidence. So am I doing? There we go. No? There we go. So brief overview. I don't know how many decades you guys have watched the evolution of evidence-based policy, but in the 90s we got the Government Performance and Results Act, where we all had to learn this vocabulary of outcomes and the difference between outcomes and outputs and inputs. And prior to that, I had spent 10 years at OMB reading congressional justifications where the term impact was used to describe the number of participants in a program. So GPRA was like a breakthrough in terms of vocabulary, but agencies really had no capacity to know how to operationalize it in terms of real serious measurement. The Bush administration tried to tackle that by creating the Program Assessment Rating Tool, which for 8 years we used to try to assess the effectiveness of every program. And that helped us. We had to wrap our minds around what outcomes were. But as much as we tried to think about rigorous evaluation and using the part to lift up its importance, we actually had some setbacks because the notion of rigorous evaluation as applied to a whole program, the odds are great that if you're going to do an RCT of a whole program, you're going to find no impact because it doesn't allow you to go in and look at the variations and find things that work. So we had to do some course corrections, and going into the Obama administration, we had new leadership at OMB, Peter Orszag, Jeff Liebman, Robert Gordon, who was my boss as head of, he was the program associate director for our area. They were all passionate about using rigorous research and using it to drive policy, and how could we move dollars from things that we don't know work to things we know do. And fortunately, we had this unique opportunity with the Recovery Act, where we were getting hundreds of billions of dollars dumped on us, and it was an opportunity to say, hey, we can use this to have a whole new approach in how we design programs so that we can drive dollars towards evidence-based practices. So that's what we've been doing, and I want to share with you, this is not, I can't offer you like Medicaid dollars. I know everybody wants Medicaid dollars. It's not my part of the world, I can't offer them. But what these strategies do are, these are about how we use our discretionary dollars or mandatory dollars that are for services in more effective ways that we get impact, and sometimes cost savings. So the common features of all of these new designs, first, they were all developed by researchers and evaluators working with program people to say, okay, let's do this up front. Let's come up with a design where everybody gets the rules, and we all agree on the criteria that we're going to use on allocating dollars, so more dollars goes to what works. Those financial incentives are both for grantees and applicants to look at existing research, so they'll get more points in a competition if they can show that they're familiar with the research and being smart about what they're investing in. We're also giving them financial incentives to be part of an evaluation process, a rigorous evaluation. We have lots of changes that we had to make to grants processes, because a lot of grants processes have been sort of, churning out dollars on a schedule for 30 years. And we said, wait a minute, we got to make the processes work for what we're trying to do. And we also realized the importance of using administrative data, where we have infrastructure in place now, and we can get administrative data from reliable sources rather than asking grantees to self-report, in many cases, things that they don't really know. So quickly, we have our tiered evidence model. I think everybody knows about the home visiting program, right? And the first of our tiered evidence models were home visiting and teen pregnancy. And it was a wonderful, revelation that, hey, we've got a couple decades of research that we can capitalize on now. So why don't we create programs that reward applicants and grantees for using the research and participating in evaluations, which is what we did in these two programs. Then we got this authority in the Recovery Act for the Investing in Innovation program at the Department of Education. It was about 2 lines of text in the Recovery Act. And it was going to allow this, it was $650 million. It was going to allow the Secretary of Education to invest with philanthropic partners in testing and innovating in K-12 education to figure out what works. Well, Jim Shelton from the Gates Foundation came in to run that program. And he was an out-of-the-box thinker. And he basically formed a partnership with OMB that said, how can we get the most out of these dollars? Recognizing that in the world of innovation, there's lots of innovation. But if you don't have evidence that goes along with it to demonstrate what really works at the end of the day, you can't sustain what you've done. So we worked with Jim and developed a 3-tiered model using the evidence pipeline, or the standards that had been developed over on the research side of the Department of Education, which had set up the What Works Clearinghouse, had a notion of here's what you would expect for an evaluation when you're starting out as a proof of concept. Here's what you would expect in terms of the research methods you use when you're trying to validate something that's been tested before and shown positive impacts. And then here's the level of rigor you expect if you're going to scale something up because you know what works. So that model was probably, it was a huge breakthrough, because in home visiting and teen pregnancy, you were essentially telling some people, you can't play unless you've got an evidence-based model. What this did is it said, everybody can play. We got room at the bottom here for the best ideas, where if you're willing to participate in a rigorous evaluation, we want you part of our club. And the theory is that you want, not all of those are going to succeed, but you want to give them a chance, and if they do well, they get to move up this pipeline. And under this model, the biggest grants are for scale-up, medium-sized grants are for validation, and proof of concept is the smallest, but everybody knows you're trying to point to the top. So, pay for success, otherwise known as social impact bonds, which I think you know a little bit about. This was, does everybody know what social impact bonds are? Yes? No? Okay. So quickly, this model started in the United Kingdom, and it was the Peterborough prison in the United Kingdom, where they were under the gun, actually the whole Ministry of Justice under the gun, to figure out how they were going to cut costs by 25% over 4 years. And they couldn't just kick people out of the prisons and say that's how we're going to save costs. They had to think about how can we reduce recidivism and the number of beds we have to pay for. And they partnered, the government partnered with the private sector and said, if you can develop reentry or programs that keep these offenders who leave prison from coming back in, you're going to save us money, and we'll give you a cut of what you save. So Jeff Liebman, who is at Harvard right now, he had been previously at OMB at the beginning of the administration. A few years ago, he saw this and he says, this is really cool because we can do a slight variation. In the UK, you pay for outcomes if you're the government. Under Jeff's model, you pay for impact. And to the extent possible, you construct these trials, you use pay for success as an evidence-building strategy. So we've got a few of these that are underway. A couple have been funded at the federal level by the Department of Justice and the Department of Labor. But the way this works is, and I'll pick New York, the private investors pay for the working capital for an evidence-based prevention service. The government has set up a contract where they're going to pay those private investors back a few years down the road if, under that contract, they've achieved better outcomes for the individuals and savings for the government. So one of the reasons why states have been gravitating towards the criminal justice world for pay for success is they're the ones who pay the costs of prison for a lot of prison costs. And they're enormous. And institutionalizing, anytime you're institutionalizing something and paying those residential costs, it's huge. So, so under pay for success, if, I think it's in New York State, there's now under the Department of Labor, a project to reduce recidivism for youth leaving prison. A provider is getting paid for doing evidence-based wraparound services that were, I think they were evaluated and found effective in an MDRC study. And the government has entered the contract that said we'll pay it back. But there's an evaluation that's built in. So it's essentially a random assignment evaluation. Actually, I want to take that back. I think the Massachusetts one is a clear case of a random assignment evaluation, but basically the same kind of intervention. And the theory is you're providing all the incentives for people, to drive towards what works. But in this case, there's the flexibility not to necessarily adhere to the model if you can find a more cost-effective way of achieving the outcomes. So there's a built-in incentive for innovation in this model as well. Let's see. Actually, just a note. So there's a whole range of interventions now that people are looking at, and the Washington State Institute for Public Policy is the place people go when they want to say what things would save money. So it's been a great resource to get people thinking and realizing that there's all kinds of public health and mental health and child welfare and juvenile justice activities that have long payoff. Performance partnerships. So performance partnerships is a new authority that we got in the 2014 appropriations bill for labor, HHS, education. It also will cover the Corporation for National and Community Service. And this is a big deal, and it could potentially be something that I think a lot of the people in this room could think about for their world. So we all complain about silos, right? And how you have these sort of rigid straitjacket programs that have certain kinds of eligibility criteria and allowable activities. And sometimes in a community, it can be very hard to weave those together. Performance partnerships for disconnected youth is the authority that was provided for 2014. And it grew out of an effort a couple of years ago where the administration had put out a question saying, what's getting in your way at the state and local level from using dollars in the most cost-effective way to get better outcomes? And a very compelling case bubbled back up from the Children's Cabinet Network and states who were trying to weave together all of these programs that could serve this out-of-school, out-of-work population from 16 to 24. And they demonstrated to us how hard it was to make them work together. And we came up with the idea, well, if we can have an evidence frame for this, why don't we test pilots that would allow high-capacity communities who have good data infrastructure, use evidence and data for learning and give them the option, the flexibility of blending money, coming up with an outcome-focused strategy for getting results. And we would measure the results and to the extent we could, embed an evaluation strategy to see whether or not this is a better approach. So we now have this authority. We're about to issue, there's a blog on the Education Department website. We're about to issue a discussion draft of how we would implement it. We're looking for really good examples, because one of the things that we want to do to get people thinking is, what are examples of where communities might want to marry a substance abuse program with an education program, with a workforce program for this population and get better results. Is anyone here familiar with the Young Men's Initiative in New York City? So you should look it up. It's a really great example of how this might work. Mayor Bloomberg looked at what the data was telling them on poverty and where the biggest problems were. And by doing a needs assessment and looking at the disparities in the data, they determined that young men of color had terrible prospects and that the services the city was funding were not meeting their needs. And so they put together, reviewing the evidence, a portfolio of strategies to see if they could move the needle on this population. And that strategy has everything you could want in terms of cross-sector collaboration, incredible data platforms, constantly looking at the data for individual providers, individual kids, and then they also have evaluation components. So MDRC is involved evaluating some of their strategies. So is everyone familiar with the 2015 budget proposal? I am not a Medicaid expert, but this may be of interest to you. The 2015 budget tries to tackle the issue of overprescription of psychotropic drugs in foster care youth. And the president's budget, this is going to require legislation, but it essentially puts out a proposal that was developed over several years by HHS, looking at what do we know about evidence-based interventions that don't require medication. And in fact, there's quite a lot of research out there on evidence-based interventions, and how can we pair that with a Medicaid strategy that creates incentives for states to discourage the use, states and for healthcare providers to discourage the use of psychotropic medication, which is terribly oversubscribed to this population. So this is going to require a push in terms of Congress, but it's pretty exciting. This whole push on kind of evidence-based program design, we are very much trying to build partnerships and infrastructure because doing it requires completely different ways of doing business. So it's a collaboration. We are looking for what are other program areas where we can embed tiered evidence, pay for success, performance partnerships, other strategies, because we've only tried a few. So much of what we do in terms of trying to build evidence could be done more cheaply if we can improve access to administrative data, create much more efficient processes for matching individual data across systems. We've got What Works clearinghouses, which are great, but we could be making them more robust, more helpful, both in terms of thinking about causal impact as well as implementation and technical assistance. And so we know that we've got more to do to make those user-friendly. And we're very much trying to build coalitions across programs, across levels of government, bringing researchers together with financial types. And I'll give you an example, just a quick example of how the collaborations across the sectors has really kind of made lights go on for people. So in Pay for Success, a lot of the early people who are interested in that were from the financial industry. They were entrepreneurs, people who came out of Capital One, who were saying, hey, there's a business model here where we can take social investment and apply it to social good, and it's a win-win for government and the investors. But they were used to like financial data that's real time, where you're constantly making decisions based on that data, and they view that data as just a movie. And there was a guy named George Overholtzer who had been at Capital One, who was very involved in this. I'm seeing nods over here. And he used to trash random assignment evaluations as being backward-looking, costly, took too long, and you know, you can't do that if you're going to have a pay-for-success model. You've got to be able to use data so that you're constantly tracking your performance of your target population against your comparison group and making adjustments as you go. John Barron from the Coalition for Evidence-Based Policy is rabid about random assignment. And so I actually challenged the two of them, and I said, can't you come together? There's got to be some middle ground here. And because there was a lot of stuff going on with administrative data, where researchers were able to do very rapid, low-cost trials with the most rigorous methods. And so what John did is he wrote a paper, which maybe you've seen, but it's identifying case studies of using administrative data for low-cost trials. And George Overholtzer is now his biggest fan. And George Overholtzer helped to implement the, set up the design and how the Pay for Success project in Massachusetts was going to work, and it's got a random assignments study. So that would not have happened if we hadn't sort of gone outside of our lane and thought, how can we do stuff better together? So I think that's it.